I just want to welcome everyone today to the Regional COVID-19 Virtual Open Forum. Today's topic is COVID-19, past, present, and future. Where do we go from here? I'd just like to introduce myself. I'm Barbara Link. I'm a quality improvement advisor with Superior Health Quality Alliance. We are connected with the states Michigan, Minnesota, and Wisconsin. Today, I am thankful to have my co-QIAs helping me out. Jessica Newsom will be providing an overview of Superior Health Connect later in the hour, and Holly Standhart is helping with technical assistance today. I think in a slide or two, we'll talk about that. So just wanted to give a quick overview of what we are going to be talking about today. We would like to take a brief look back at some of the topics we've facilitated during these calls. These calls came from a request early in the pandemic to provide all settings of care a venue for exchanging ideas, discussing concerns, and learning from each other. We wanted to take a moment to thank all of you for the extraordinary work you've done, as well as your staff during this unprecedented time. Many lives have been lost, and everyone has been touched in one way or another by this pandemic, personally and professionally. But through all of this, new relationships have been formed and stronger ties have been made, and innovation has come from a very difficult and dark time in our current and present history. So we hope that through all these calls, you've learned a strategy to cope, developed a practice to increase communication that saved a life, and bonded with someone that will be a lasting connection to improve patient care. We've been very grateful to be alongside you during this time, and we just wanted to take a moment to review some of the unique presentations that came from your requests over the past year. Today, we also want to take a moment for everyone to share where they are. This is one of the most important part of these sharing calls is you, the participant, coming together during our open forum times and exchanging ideas with each other. So we want to continue that today when we take some time for everyone to talk about where your organization is at currently with different vaccine compliance policies, mask wearing, issues on stress that your staff may be having, those sort of things. We also want to include that in our present portion of the call. And then we want to provide you an overview of our new format for the COVID-19 All Settings calls, and that's going to be through our Superior Health Connect platform. Jessica will be providing a guide for you through the registration and how in this new group that we have, how you can share ideas and exchange information in our new platform. We're very excited about that and hope you take advantage of it if you haven't already registered. So just a few things. As always, please mute yourself when you're not speaking, and remember to unmute if you have a question or comment. And if you could state your name, your state, and organization when you're participating. If participating by phone, you need to press *6 to unmute yourself, and then also *6 to remute. Do not disclose any personal health information of your patients. And if you have trouble with Zoom, please message in the chat Holly and she'll help you out. If you have any other questions or comments, please chat them into everyone. And today's call is being recorded and will be put on our YouTube channel for future viewing. Just a quick overview again about Superior Health Quality Alliance and who and what we are. We were formed back in 2018. We have different organizations throughout 6 states, and mainly through our quality improvement work, we are working with Michigan, Minnesota, and Wisconsin. We work to achieve broad national CMS quality strategy goals, and our goals Our goal is to collaboratively improve the quality and healthcare for consumers, patients, clinicians, organizations, and the communities we serve. This is our 3-strategy approach that we're using to achieve those goals. And we're quite excited that today we're going to dive deep into the Affinity Group strategy for the COVID calls. So you'll have a good sense after this call what an Affinity Group is and how you can take advantage of that. Our independent implementation is really focused on action guides, toolkits, resources that you can use on your own, also within Superior Health Connect are independent courses that you can take as well at your own pace. Very exciting. And then we have our structured collaboratives, where in real time, you're going through intensive workshops with subject matter experts on different topics and using, if some of you know, the ECHO format in that area. So we have different levels of approaches, and we're quite excited that we can use all of those levels of approach when we're talking with you and your specific needs for quality improvement. So I thought I'd just take a moment to sort of review some of the highlights that we've had over the past year. Many of our open forum calls have had specific presenters and different topics. Again, at the end, we will show you how to get into Superior Health Connect. And with all of our invites, we do direct you to our YouTube channel that you can watch past presentations and get information on that. These calls started back in March 20th, 2020, and it opened with this simple question: can you please tell us where to find PPE? And I'm sure many of you remember back to the time where people were even just struggling to find appropriate masks and gowns to provide help to their patients. And the region shared suggestions and resources for equipment at that time in real time. We even talked about how telehealth could be expanded. We talked about sharing a COVID transfer form between settings of care and how to discharge patients with pending results. Seems like such a long time ago, but we really developed hands-on approaches and resources for all these things. And the majority of it came from the open forum time, exchanging ideas, talking about how one setting was dealing with these issues and giving resources to people. It was quite a plan, do, study, act time, and people really stepped up. From there, we took your suggestions and developed different targeted subject and webinars in response to what you needed. We had Dr. Redwood, which was one of our highest attended COVID calls, where he is an ER doctor, talked about what he was seeing in his ER, how they developed protocols and responses to COVID-19. We had patient stories with a caregiver panel facilitated by Jane Peterson, who is the Chief Medical Officer at Stratus Health. It was a very emotional panel with a niece and an aunt, Bernice May Ramsey and Minito Razor, talking about their experiences with their family members. And what came from that is just sometimes the simplest things mattered the most to families, that they could have a direct care provider provide a cell phone for a family member when they couldn't get in touch with someone who was hospitalized, just keeping them up to date on a daily basis as to someone's care, providing that connection when someone needed end of life care. And those were the things that really came through from that panel. And then to go full arc, one of our last presenters, Dr. Haley Prescott, talked about long COVID and the things that we're seeing after a diagnosis and people dealing with residual and ongoing concerns from COVID-19. So all of these webinars and the resources that were developed are going to be in our Superior Health Connect specialty group in the COVID-19 section. So we do hope that once Jessica walks you through enrolling in that, you take advantage of that today as well. So with that, I wanted to open up our discussion portion. The speakers were wonderful with all of our webinars, and we had great responses. But honestly, the core element of all of these calls were you, our participants, and the sharing that occurred during our open forum times, the connections that were made. And so we wanted to introduce just questions for discussion for today. Some thoughts we had, but certainly anything that's on your mind, we want to open that up as well. And that would be maybe some things about how your organization is handling opening up, having patients come back into your facilities, mask wearing policies, how you're dealing with vaccine compliance among your staff, any policy development, just some things we were thinking about, but we want to hear from you as to what you might be thinking about as well. So at this point, I just wanted to open up the floor for any ideas or things people want to ask, or maybe answers to some of the questions on this slide, and go from there. Well, it looks like, yes, Kim, did you have some comments? Hi. Good to see you.
Yeah, we were, a couple of our sites were on Project Echo's call this week, and a common theme is trying to find ways to increase staff vaccination rates. So very interested in what other sites are doing. I know our sites have required weekly messaging around COVID, and we certainly include in that messaging an appeal to staff for vaccination. And we've done some one-on-ones with the infection preventionists, but just curious if anybody else has any other tools that have been successful in that arena.
And at this time, you certainly can unmute yourself and answer Kim's question or chat in a suggestion, any ways that you've been dealing with vaccine compliance at your facility.
Hi, this is Wanda calling from
Hi, Wanda.
Lakeview Health Center in West Salem, Wisconsin. And maybe we're being quiet because we don't have any great answers for some of this, but we currently are at, I think, 85%, and that's fluid, of course, with staff coming and going, but we're at about 85% fully vaccinated staff, and then our residents a little bit higher. So I think that one of the things that we've done is just continue to do individual reach outs. So we have, I think there's 15 of our staff who have not been vaccinated, and funny enough, not funny, but they are mostly on the night shift. So we have been trying to do individual reach outs by either administration, DON, or infection preventionists on a fairly regular basis, trying not to bug them, I guess, but just reaching out to see if they have any questions, if they need any information, if we can help them get an appointment set up, any of those things. So, and we do have a current relationship with our current pharmacy provider to actually provide those on site during work time. So that's what we're doing. I can't say that last 15% seems to be budging. I called most of them initially. I actually just called them the not yets, not the no's. But now I'm finding that some of our staff are a very firm no for whatever reason. They're a firm no at this point. So I don't have any great answers. We've just been trying to do individual follow-up.
I do have to say, Wanda, 87% is great. What did you do initially to get to that 87%?
I personally met with every person. I mean, we're a smaller organization, have about 200 employees. And so I did try to reach out to, well, not every person that initially said, I'm not sure. I reached out to each of them. We got them their questions answered. We really started that campaign really, just right away. And that seemed to be fairly effective just in having those individual follow-ups right away. But yeah, I think that the staff overall, I think were very really positive in the areas that we've continued to, I think, see some of those people have questions has been more in our assisted living, but again, overall that campus is at that 80 to 90%, depending on, like I said, who's left us and who's come in. And we are finding that I would say not all, but many of the staff coming into us now, new staff, have already been fully vaccinated. So that is encouraging.
That is very encouraging. Any particular reasons why that 15% or so, any reasons why they're saying they don't want to get vaccinated? Do they have allergies or some medical reasons, or is it just hesitancy?
It is, I would say, more politically based for them, that it's more of their political beliefs. It's not medical condition. It isn't religious conviction. It is just having the sense that it's my personal right to make a decision, and I don't want you to tell me what to do, and I don't want to do it. So it really has been that, and that's a much harder one to move off the mark.
It is. Yeah, that is a challenge. But thank you. Great input, though. I am thinking that you personally called all of your staff. I really admire that. That means that it's something very important to you. And I think not everyone would be able to do that, but I think that that's actually a great strategy. It means that you're that, you think it's that important.
Mm-hmm. Really had some staff that had only the first shot of a 2-shot series, hesitant to get the second shot. These are staff that had COVID prior to the first shot. And what they found with that first shot was a very, very strong reaction, which our infection preventionist explained to them was, since their immune systems were already primed by the original infection, that vaccine was working as it should, and they probably would not have that strong of a reaction to the second shot. So many of those are now catching up and finishing that shot series. They just need information and need rumors dispelled.
Yeah, I went to an in-service early on about a protocol that was developed, and it sounds like many of the things Wanda and Kim you're doing, but they talked about people need information. They need an advocate, in that they like to hear from someone, maybe even in a parallel position, that had the vaccine, that said that it's okay. I think that's a great idea about having the infection preventionist provide, actual information to the people, because then it shows true. This is what's going to happen. When people know what's going to happen and they don't think it's outside of what should be happening, I think they do feel more comfortable accepting vaccines or any intervention. But they did talk about having, somebody who would be a designated advocate on staff that people really respected and things like that. And it could be from management. It could be from someone in, their peer group, that seemed to have a good effect, as well as, yes, then having the facts and having it from someone who had that background to provide them the facts for vaccination. So kind of just goes along with what you're already doing, but anyone else have any input or struggles with that situation? And I'm just wondering about how your staff is managing all of this. Anybody having issues now with, say, even symptoms of post-traumatic stress, or have you had high turnover rate or anything like that, having to train new staff into your facilities? Just wondering how you're dealing with that, if that's an issue. Well, I do know that we just had what we would term a structured collaborative around increasing vaccine compliance, and we'd be happy to share that information after this webinar as well. And that was something that occurred on Thursday mornings, a few sessions in a row, just talking about really taking a deep dive into how to work through vaccine compliance and hesitancy within staff. So I think there was a lot of valuable information shared through that in service. So we'll make sure that you have that information afterwards as well. Just wondering if there's anything else on anyone's mind, any other concerns? Well, let's see if I can.
Call from 1775.
Okay. Well, and I just want to make sure I don't see any new things in the chat. Holly, am I missing anything in the chat?
No, you're not.
Okay. All right. Okay. All right. Well, I do think that that was a good discussion about vaccine hesitancy and compliance. If anything, we will move on to Jessica doing the walkthrough for Superior Health Connect and providing that overview. But if anything comes up while she's showing the walkthrough, please chat it in and we'll discuss that as well. Okay. So we're very excited about this new platform, and many of you already might be taking advantage of it. It's very easy to register. It is our Superior Health Connect platform, and it has many different groups in it, and it has posts, and you can connect with other people across our 3-state region about best practices and information. We also do have some independent courses posted there on self-managed blood pressure and our frontline forces information targeted at skilled nursing facilities is there as well. So there's quite a bit of information. So it's a great platform, very easy to access and connect with people. So today we thought we'd take a moment because we have developed a COVID-19 all settings affinity group in this. And so I will turn it over to Jessica to show you what it looks like and how you can get registered for it if you haven't done so already. So Jessica, and I can just advance the slides for you. Would you like me to do it that way? Okay,
Yeah.
I'll just do that.
Awesome. Thank you, Barb. So we will go through how to register if you are not already in Superior Health Connect, how to participate in our new COVID-19 All Settings Affinity Group, and how to show resources and information in the COVID-19 All Settings Group, and how to navigate and access and use the group forum section. Next slide, please. So if you have not already received an invitation email to set up your profile in Superior Health Connect, please email us or let us know in the chat that you would like to request an account. And after this meeting, we're going to send an invitation to everyone on this call today, so that clicking that link will also help you set up your account. Thank you, Barb. Once you have created your profile in Superior Health Connect, you will be able to join groups. Once you're in Connect, on the left-hand side of the homepage, you will see the main menu, which looks like this. And third from the bottom, notice the groups link. That's what you will select first to join the new group. Next slide, please. On the groups page, it will look like this. You will see all of our current groups. The COVID-19 group is a private group to start, so you will need to select Request Access. Next slide, please. So after the host approves your request to join the group, you will receive an email that looks like this, letting you know that you can now view the group with a link that you can click to add your first post. Next slide, please. Inside Superior Health Connect, after approval, you will also get a notification like the top right image shows. And when you go to the group page, now you will see that it says joined by the COVID-19 All Settings Affinity Group. And then you can go ahead and just click the group to enter. Next slide, please. Once you click to enter the group, this is what the page looks like. You will see a box at the top where you can add a post. Below that, you will see the welcome post and any other featured or pinned posts. And then the general feed begins. This group will be the new home to all of our past COVID-19 open forum call resources gathered over the last year, and where we will continue our open forum discussion and sharing of resources in real time in the future. We encourage you to turn on your alerts and check the page often, ask questions, and add comments to participate in the discussion. At the top, we will pin the welcome post so you can easily access this. And that kind of goes over our group rules. So for this group, the goal is to share information about COVID-19 and start a conversation about COVID-19 related topics with engagement from all settings of care. We ask that when you share information that you include the source in your text with a link if possible, so others can access the original information. One goal of this group is to start conversations and share ideas for topics that could be discussed during future live calls, like the call today and the ones over the past year that we've held on Zoom. We are really interested in your feedback to help us structure future live events. And lastly, this group is in all things COVID-19 related. So we encourage you to ask questions, share resources for feedback or clarity, and we love when you share best practices that have helped your practice. Next slide, please. So after you click the box at the top to add a post, it will open and look like this. You can type text where it says, share what's on your mind, and you can click the images along the bottom to add pictures, videos, links, and attachments to your post. When you are ready, select the post button on the bottom right to add the post to the page. Next slide, please. Here is an example of what a post will look like in the group. This post is live in the group now if you want to check it out. To add your comment, click the plus sign at the bottom of the post or the little conversation box icon next to the heart icon. You can use the icons in the text box to add pictures, videos, links, and attachments. When you are ready, select the comment button on the bottom right, and your comment will be posted live on the page for everyone in the group to see. This concludes the Superior Health Connect walkthrough. I'll just pause a moment to see if anybody has any questions.
Jessica, this is Holly. We had a question in chat. So this is coming from Kim. What providers are included in the Affinity Group? Is this only SNF or all care settings? So acute care, home health, any others?
Great question. All of the above. So we want every single representative from any care setting to join this group and participate.
Yeah. And then also another question from Kim as well. Thank you, Kim. So again, what providers are included in the Affinity Group? Is it only SNF or all care settings? And we just discussed that. Does the Affinity Group offer an option to tailor notifications, daily, weekly, etc.?
Yes. Yep. So once you're in Connect, if you click the little bell icon on the top right, which will be by your picture, you'll have the option to change your settings to however you'd like. So you can change it so you get an alert every single time a post or a comment is added, or you can change it so you just get a daily summary of everything. And you can also do weekly summaries as well.
Fantastic. Thank you.
Yeah, great questions.
Yeah. And that's for this particular group. Other groups, if you look in Superior Health Connect, they are a little bit more targeted on a setting. Our infection control, many of the resources are targeted at skilled nursing facilities, but they can be, broader as well. We do have a care coordination area, and that, of course, is all settings as well. So, I would really encourage you to go in there. This is one of our affinity groups, but there are other affinity groups that are targeted at setting, condition. We have chronic health conditions that might be a little more tailored to the practitioner side in, the physician office setting. But really, take a look, go around. This COVID-19 is all setting, but the other groups are sometimes targeted at a different, specific topic. So we're quite excited about it, and we're trying to address like all levels of need too.
Okay, and then sorry, we had one more question. If we could send the list of affinity groups in the post-session follow-up message, that there might be other groups that this group may want to join.
Awesome. Great idea. Yeah. So right now on the groups page, you'll see two groups, this COVID-19 group, and we also have a opioid stewardship affinity group that got started a couple of weeks ago. And we like to call that group All Things Opioid. So that one is also for all care settings, all types of providers, for any types of resources or questions. Yeah, we'll definitely send both of those links in the email invite, and we encourage you to join both of the groups. And I just wanted to say for the COVID group, if you want to put in if you have a question about a specific care setting, feel free to put that in the post if you are a SNF provider or an acute care setting provider and you have a specific ask or need, share that in the group.
Fantastic. And we got another question from Jenny. She wanted to know when will we know when a new affinity group is started?
Great. Yeah, that is a really great question. So my easy first answer would be to just check the groups pages in Superior Health Connect frequently. On that groups tab, the third from the bottom I showed on the first slide, that's where you'll see all of the groups that are happening right now. And then some of the groups, depending on your affiliation, we might invite you to join the group. So you may receive a personalized message with a link saying, hey, we would love for you to join this affinity group. And you can also invite other members to the group. So if you're in the group and you know of a colleague or someone else that you think would be a great addition to the group, you can also invite them to create a profile and connect and then join the group. Yeah, you're welcome.
Now we had a question, a direct question came through. This is in regards to our open discussion. So whenever you're ready to address that question, we can move back on over.
Yeah, I think if there's no other Connect questions, I can hand it back over to Barb to continue the discussion.
Great.
Okay. Fantastic. So the question that we received in direct chat was if anyone could discuss how they're handling staff that don't get vaccinated. So is there anything that is being done? Like, are they separated from, working with patients? Is there anything else that might be, addressed, again, for anyone who might not receive that vaccine? I know a lot of times individuals who don't receive influenza vaccine, they're expected to wear, face masks, or again, they cannot have, direct patient care, or they, other facilities might move that employee to, a different area. I don't know if anybody has had anything like that happen. Okay, it looks like Kim shared, we continue to have a mask mandate in place in skilled nursing for all staff. Non-vaccinated staff can provide direct patient care with the expected precautions for both staff and resident. Thank you, Kim.
Not to put Wanda on the spot again, but Wanda, you had such a good response. Do you have any other protocols or suggestions regarding those that aren't vaccinated, or how are you handling that in general?
Yeah, well, they still are working, of course, on the direct care areas. We have been talking to them about sort of our expectation and our plan. So right now we have not modified our PPE requirements for our staff on the household, so that they still are wearing eyewear and goggles at this point in time. But we have been letting our unvaccinated staff know that it is our expectation that as we modify those requirements, we expect to be modifying them for vaccinated staff, but not for unvaccinated staff. So we have been talking to them about sort of our long-term plan, again, to protect our residents, because we do have, I would say there's probably one resident on every household who has not been able to be vaccinated. And because of that, we feel like we will be doing some additional PPE. But at this time, we actually have not lightened up on our PPE in any of our households yet. We expect to hopefully be doing that by the end of summer.
Thanks, appreciate that as well.
Kim made a great comment. Our larger issue in skilled nursing is a non-vaccinated visitor and the risk they bring to non-vaccinated staff and non-vaccinated residents. It's a huge risk for bringing COVID into the building because they aren't part of the facility safety bubble. That's a great point, Kim. You certainly, now that those restrictions have lifted a little bit, yeah, certainly. How do you protect, those within your facility? Thank you for sharing that. And then Cindy had a comment. We've modified our eye protection policy, hospital and clinic, for vaccinated staff. Eye protection is no longer required for regular patient contacts, only for COVID patients and PUI. Thank you, Cindy. Again, another great point.
Has anybody had to address those non-vaccinated visitors, or how are you maybe even monitoring that? Like, are you asking for their card, or? That would be, to me, I think, a challenge for a family member. I mean, to talk to family members and such. And
this is Kim again. We can't ask them for their card. We can ask if they would like to share their vaccination status, and we can certainly remind all visitors that there are certain requirements for the unvaccinated, and then certainly, have our staff keep an eye if a visit is going on. Obviously we have requirements on where that visit can take place based on the resident status and the guest status. But, if things go awry, we certainly intervene and make suggestions for compliance.
Just out of interest, Kim, who tends to have those? Is it a nursing staff? Do you have social workers on staff who try and talk to families about these things? Just sort of curious how you handle that from a staffing issue.
Well, the staffing itself is problematic. So it's, it tends to be, your highest rank in the area or someone that's on our leadership team that happens to be rounding in the area. The visits are scheduled at this point because we do need to provide that oversight, for those situations. So we typically have someone assigned to monitor that visit in some way that's readily available.
Thanks. I really appreciate that. That was something interesting to me. Thanks. All right.
Hi, Barb. This is Jerry with Jerry Henniker with
Hi, Jerry.
Hi. Well, I wanted to follow up on Cindy's question. I kind of had I don't know how many on the call today are actually from home health, but I know one of the questions we've had with some of the home health agencies we're working with is when you're going into person's homes, of course, it's not only the patient you're caring for, but a lot of times you have family members there. And so it's, they can't really, not only it's hard to ask vaccination status because, people don't have to tell you, but with family members too, or even their COVID status. So they've had a hard time with dropping, even like the eye protection along with the PPE when they go in even if the staff are vaccinated. So I'm not sure if there's anybody from home health who has any comments on how they're handling that, now as they're making more or having more staff vaccinated, but also more patients vaccinated. And I just wanted to make a comment too, these types of conversations and questions we're having right now today, this is what you're gonna see on the Affinity Group, when you join. It's a great opportunity to get your questions asked. Don't have to wait for our Thursday calls. You can ask them at any time and have these conversations with your peers across the 3 states, Minnesota, Michigan, and Wisconsin. So I just kind of wanted to add that in here too. You can ask anytime if a question comes up.
Thank you, Jerry. Thanks. Yeah, I didn't. And that is a great example right there. I know a few people from our area in the home health arena, and I didn't notice their names today, but anyone else in home health that can talk about how they're addressing some of these issues? Okay. All right. Looks like someone just chatted in.
It was actually just me.
Okay.
Barb, yeah,
Okay.
For evaluation.
Okay, great. Well, if no one else has any further questions or things they want to pose, we certainly will also post that home health question in our COVID-19 and see if COVID-19 Affinity Group and see if anyone else has any answers regarding some of those things too. So at the top of the chat, Holly did post the link to the PDF file of these slides for today. So if you want a copy of the slides, you certainly can get them there. And then she has just posted the evaluation for today. We would really appreciate your feedback on even this presentation, as well as any other suggestions for maybe post to the Affinity Group. But we really want you to go on over there and check it out and become a member of that, because I think it will continue this conversation, but as Jerry said, in real time and with your counterparts across our 3 states. So we're pretty excited about it. And again, there's also a lot of other features like independent courses you can take, other topic areas you can pursue, posts you can make or posts you can see from other people. So it's quite an interactive platform, and we're really excited about having the opportunity for an affinity group for this group. And so I think if there isn't anything else or anybody has any other questions, I just want to circle back to Jess and Holly to see if I forgot anything or.
No, I think you covered everything. And again, if you know anyone who is interested in joining our Superior Health Connect, they can also email us at info@superiorhealthqa.org.
Great. Well, again, I cannot thank you all enough for your participation over the last now year and a half. Vaccine compliance really keeps increasing. I know that it's a heavy lift at this time, but you all are being very innovative and sticking with it, and it is showing that it works. So we're just so happy that we could offer these calls and that we can continue this in our new platform for exchange of ideas and support. And I hope you do take advantage of it. And again, as Holly said, if you have any questions, can you say the email or chat it in there, Holly? So people can check that out too.
At superiorhealthqa.org. And I'll get that in there one more time.
Thank you. Thanks, Holly. Appreciate it. All right. So it's a little bittersweet for me. I really appreciate all my co-workers who have supported this through Superior Health Quality Alliance. We all took this on as a labor of love, as a weekly phone call in the very beginning, and really realized that people really just needed information and support, and people took advantage of it and really supported each other. I just can't thank you all enough for everything you've done throughout this really unprecedented time, and how much it shows that you really want to support each other and provide quality care to all of our patients. So thank you so much, and hope to see you in Superior Health Connect and continuing the conversation. So thank you.